Today, we're going to talk about a serious topic that's been making headlines recently: monkeypox, or as it's sometimes referred to now, Mpox. This virus has been detected all over Europe and is spreading rapidly in parts of Africa. We're going to break down the current situation, discuss how the virus spreads, and whether we should be concerned about it spreading further. Let's dive in. First off, let's talk about where monkeypox has been detected. The virus has spread widely across Europe and several African countries, including South Africa, the Democratic Republic of Congo, the Republic of Congo, Central African Republic, Cameroon, Nigeria, Ghana, Liberia, Rwanda, and Burundi. In response to this, the World Health Organization has declared a global state of emergency. The African Union has also declared a continent-wide emergency due to the virus's spread in African countries. As of now, more than 14,000 cases have been reported worldwide, with over 600 deaths recorded. Now, let's talk about how monkeypox spreads. The virus can be transmitted in a few ways: sexual intercourse, skin contact, and close proximity. Monkeypox can be transmitted through sexual contact, direct skin contact, or even by being near an infected person while talking or breathing. The virus can also spread through open wounds, the respiratory tract, or through the eyes, nose, or mouth. Comparison with COVID-19. Given this mode of transmission, it's clear that monkeypox does not spread as easily as COVID-19. While cases may still occur, controlling the virus should be more manageable compared to the coronavirus pandemic. Now, a lot of you might be wondering, do we need a vaccine for monkeypox? The answer is, it depends. You can get vaccinated if you feel the need, but personally, I don't think it's necessary, especially when considering vaccines like mRNA. Currently, most cases are confined to Africa. While there's a possibility that the virus could spread to other parts of the world, I don't believe it will happen rapidly. As I mentioned earlier, we might see sporadic cases here and there, but monkeypox doesn't seem to have the ability to spread as quickly as other viruses like COVID-19. Finally, let's address the question of whether we need to impose closures or restrictions. My answer is no. Implementing such measures for a disease that doesn't spread rapidly through droplets or air would be extremely inappropriate at this point. It's essential to remain vigilant, but also to keep things in perspective. Right now, the focus should be on monitoring the situation, supporting affected regions, and ensuring that we respond appropriately if things change. So, to wrap things up, while monkeypox is definitely a concern, it's not something that should cause widespread panic. Stay informed, take necessary precautions, and we'll get through this just like we've managed other challenges in the past. The saga of Mpox, or as some call it, monkeypox, has taken a turn for the dramatic, much like a plot twist in a soap opera, but with less romance and more science. The World Health Organization has rung the emergency bell, declaring Mpox a public health emergency of international concern. This isn't just any old health advisory. It's the equivalent of the universe saying, "Hey Earth, you might want to pay attention to this one." Why the fuss? This isn't your typical Mpox outbreak. We're dealing with a new strain, Clade 1b, which seems to be more interested in human-to-human contact, especially through sexual networks. It's like the virus decided to get a bit more social, or should I say, antisocial in the most literal sense. The virus has been gallivanting across Africa, with significant outbreaks in the Democratic Republic of Congo, DRC, and its neighbors. This new strain seems to be more deadly, with a higher fatality rate than its predecessors. It's like the virus got an upgrade, but not the kind anyone was hoping for. The WHO, along with the Africa CDC, is not just sitting back. They're calling for international cooperation, which in human terms means everyone, Let's pool our resources and brains to stop this. They're looking at vaccines, diagnostics, and all sorts of public health measures to curb the spread. There's talk of vaccines, but here's where it gets interesting. While vaccines exist, the WHO is cautious about their use, suggesting they might not be necessary for everyone due to the virus's transmission mode. It's like having a fire extinguisher when your house is made of stone. It's there, but maybe not your first line of defense. Unlike with other pandemics, there's no call for widespread lockdowns or masks. The focus is on close contact, so it's more about being careful with whom you share your space, literally. From what I've gathered from the digital town square, there's a mix of concern and the usual human tendency to panic or ignore. Some are treating it like the latest episode of a medical drama, while others are genuinely worried about the implications. Mpox has decided to make a comeback, not with a bang, but with a very contagious whisper. The world's health bodies are on it, but like any good story, the ending isn't written yet. Stay informed, stay cautious, and maybe, just maybe, keep your social circle to those you trust with your health. After all, in this galaxy, and especially on Earth, health is the new wealth. It's as if Mpox has taken on the role of a villain in a cosmic drama, with humanity as the heroes trying to thwart its plans. The WHO's declaration signifies a shift from a mere alert to a full-blown emergency response. The virus has been particularly active in Africa, notably in the Democratic Republic of Congo, and is now spreading to other regions. It's like watching a slow, deliberate march across the continent. The global response varies. The United States, for instance, has assessed the risk as very low, indicating a cautious but not panicked approach. They're monitoring the situation closely without sounding the general alarm. The World Health Organization is advocating for a unified global response. They're pushing for vaccine distribution, enhanced community protection, and a coordinated effort to contain the spread. It's akin to organizing a global defense strategy. Mpox isn't as contagious as some other viruses. It spreads through close contact, not through the air. However, vigilance is key. It's not about avoiding all human contact, but being cautious in our interactions. Stay informed without succumbing to panic. The WHO and health authorities worldwide are actively managing the situation. Like preparing for any crisis, we should be ready but not paralyzed by fear. In the grand narrative of human survival, we're all characters trying to navigate through unexpected plot developments. This concludes our discussion on Mpox, highlighting the importance of global cooperation and individual responsibility in managing health crises. Monkeypox virus was first discovered in 1958 when it decided to crash the party of some research monkeys. Not content with just being a monkey's disease, it made its human debut in 1970 with a 9-month-old boy in the Democratic Republic of the Congo. This isn't your average pox party. Monkeypox virus belongs to the orthopox virus genus, making it a distant cousin to the smallpox virus, which humanity thought it had seen the last of. But, like a plot twist in a sci-fi movie, here comes monkeypox saying, "Not so fast." How does one catch this unwelcome guest? Direct contact with infected animals or humans, or even touching things that have been touched by those infected. It's like the virus plays a game of tag, but instead of "you're it," it's "you're infected." Imagine starting your day with a fever, then your skin decides to throw a rash party that lasts 2-4 weeks. Swollen lymph nodes, headaches, and muscle aches join the fun, making you feel like you've been through a medieval torture session. There are two main clades, or branches, of this viral family tree. Clade 1, the more severe sibling, and Clade 2, which is like the less annoying cousin. Clade has been known to be more deadly, but let's not give it too much credit. Even Clade Descent can make you wish you'd stayed in bed. 2022 saw monkeypox, now Mpox, spread globally. not just sticking to its tropical roots. This wasn't just a travel souvenir. It started mingling in places where it wasn't invited, thanks to human-to-human transmission, often through close contact, including what we humans like to call intimate contact. The advice? Avoid close contact with infected individuals or animals. If you're infected, isolate like you're in a sci-fi quarantine zone. And for those not infected, maybe skip the exotic pet trade unless you fancy a rash. Here's a twist. Smallpox vaccines offer some cross-protection against monkeypox. So, in a way, we've been preparing for this sequel without even knowing it. In conclusion, monkeypox, or mpox, is not just a disease. It's a reminder that nature's got a sense of humor, or perhaps a vendetta, against our species. But with science, a bit of caution, and maybe a dash of luck, we can keep this viral party crasher at bay. Remember, folks, in the grand game of evolution, sometimes you're the windshield, sometimes you're the bug. Let's try to be the windshield this time. Thank you.